Hello and welcome everybody to Natural Medicine Month. We're starting a little bit early because we have so many webinars to get through. We've got something every day of the month of May pretty much. And so we are kicking off today. My name is Annie Gibbins. I'm the CEO of the Australian Traditional Medicine Society. And I'm also a global leadership expert with over 25 years in C-suite experience, and I help guide organizations and executives to achieve success in all things they do, and particularly stay naturally well. We have joining us today Anthea Kularis, who is a naturopath and herbalist. She has over 29 years of clinical experience. Anthea is a leading naturopath, homeopath, and herbalist. You're going to find out all about these different areas of specialty. She's also the founder of Apotheca by Anthea and the author of I Am Food, a guide to eating for health and vitality. She's super passionate about the power of herbal medicines, teas, and nutrition, and all things well-being. So welcome, Anthea.
Thank you so much, Annie. I'm delighted to be here with everyone. So, yeah, I'm excited for this chat. This is a good one.
Fantastic. We are also joined with Dr. Vinita Jolly. She's a doctor of traditional Chinese medicine. She's also the principal practitioner at Balanced Med. She's got qualifications in traditional Chinese medicine and naturopathy. She specialized in Japanese acupuncture, fertility support, cosmetic acupuncture, helping patients restore their balance naturally. Welcome, Vinita.
Thank you so much for having me. I'm excited to be here.
Great to have you join. We've got such a great panel today. And Amy Tyler is also joining us. She is a remedial and oncology massage therapist. So important. She's an award-winning remedial massage therapist, actually, and she specializes not only in oncology, but also scar and lymphedema massage, supporting patients through their healing journey. She's also the founder of the Institute of Oncology Massage, where she trains therapists how to work with people who have been impacted by cancer. So important, such important things to be working with people. And we are going to have a great session today with all of our guests from natural medicine, because we're going to be talking across as a starter for Natural Medicine Week, all these different areas. There's so many areas amongst our three experts today. So what I'm going to do is, if you have a question, just drop it in the chat. We would love to hear from you. And I'm just going to kick up the conversation and help our ladies really start sharing some of their knowledge with you. I might start with you, Amy. We might start with massage, because that's an area that most of us have actually sort of gone off to have a massage. But how can massage support people going through cancer treatment or managing chronic pain? It's not something that you would automatically think of as a consumer, but it's super, super powerful in that way, isn't it?
Very true. Thanks, Annie. I think, yes, most people have had a massage of some kind, whether it just be from a family member or whether it be at a local shopping centre or through a clinic. Specifically with cancer patients or people with chronic pain, remedial massage and then oncology massage is an adaptation of remedial, so it falls under the same banner. Really just helps to calm the nervous system. So we often sit in a state of stress, whether that be financial, work, relationship, all of the different stresses from day-to-day life. And unfortunately, that builds up in our system, and then we can have different issues, whether it be repetitive strain from desk work constantly with work, whether it be cancer-related pain. And massage really helps just shift you out of your state of stress into a state of calm. So you relax. As a byproduct, your muscles relax, which reduces pain, and it also helps shift that body into that parasympathetic nervous system, which is, I like to say, where the magic happens in the body. It's our rest and digest. So it's where all the good stuff kind of happens, where our own body's healing happens. And as I said, byproduct of that is pain reduces, anxiety, depression reduce. So there are a lot of different aspects to it. We don't just have to think about the good old classic dig in, no pain, no gain massage, get into the one and only muscle that's sore.
Yeah.
We actually look a lot more holistically at the body than just that.
Which is so important to hear, because I am probably like many people joining us this month over Natural Medicine Week. And I think, oh, if I'm a little bit tense or I just need a bit of relaxation, I'll then think of having a remedial massage. But what you're actually saying is it's not just for then, it's actually for any time that it's generally good regularly anyway, but also it is specifically good even if you are in pain, to reduce pain.
Yes, exactly. It's a great maintenance. Why get in pain in the first place? I always say,
Yes.
better off to actually get things sorted quickly. But if you are in pain, then it can be lots of different types of pain, right? It could be because you've had an injury, could just be because tension has built up over time and you don't realize. And then suddenly you hit that breaking point of, actually, no, today's the day that ricochets off into pain. It could be that you have a tumor pushing on a nerve or causing pain within bone. Some of those things we can't actually get rid of the cause, but we can shift that signaling back to the brain so the body sits in more that state of calm rather than triggering that pain signal constantly. So, yes, it's whether you're in pain or whether you are heading towards pain, that's a great time to have a massage.
And I know you can even do it post-surgically, so which might surprise some of our members today or visitors today, that you can even sort of tailor your approach with people who've got really quite complex health needs, vulnerable health needs, post-surgically, or even when you've got severe pain from cancer. I know as an oncology expert there, what do you have to be mindful there? Or if you're a patient who has just had surgery and was thinking, oh, is it okay to have a massage? How do you actually go about sort of tailoring to that person?
So certainly most remedial massage therapists, if they haven't gone off and done additional training, then they're going to be taught not to work on patients for about 6 weeks post-surgery. However, there are lots of therapists out there who have done additional training, and that training could be in manual lymphatic drainage, it could be in oncology massage, it could just be in post-surgical massage. And that means that we can really work with anybody from the day after surgery. We will adapt that treatment to take into consideration a higher risk of DVTs, so deep vein thrombosis. We don't want to do any deep tissue massage at that point and for quite a period of time after the surgery. But we'll adapt our pressure. We will adapt even how fast we do things, so the sequence that we use, just to make sure that we're not putting the body under any additional stress, but again, bringing it back into that state of calm. And somebody could be in the hospital bed after surgery, or between surgeries even, depending on what they're in there for. And if we've got a trained oncology massage therapist or hospital-based massage therapist, then they can even work with somebody at that point in time. And as you say, most people will maybe want a massage because they're stuck in bed post-surgery, often not their own bed. They're sore because they're not moving.
With
they're
an
sore because they've had
mattress.
surgery. Uncomfortable mattress. So then, most of the time people will say, oh, I can't massage you just yet. But if we find someone who has that just postgraduate training, certainly we can adapt it to make it appropriate in that time frame. And that's, as you said, any vulnerable client, anybody with an intense medical history. It's about the communication between the patient and the therapist. We'll ask a lot of questions. And that will just tell us what we can and can't do in the massage to make it appropriate in that time frame.
That's what I love about ATMS. Those of you who are just joining us, if you go to the atms.com.au, you can actually find a practitioner, and our practitioners are really well qualified, trained, certified. And if you're looking for a specific practitioner, such as Amy, who specializes in oncology, for example, you can even ring us and we can help you find a specific practitioner. And before we go on to the other modalities, I'd love you to talk. So it's not just about physically feeling great. There's real research showing that you're emotionally and mentally more sort of grounded or calm after a massage. Isn't that right?
Absolutely. So anxiety and depression are massive in the general population, but also big in the cancer community, obviously. And just shifting that body out of that state of stress into the state of calm really shifts everything within the brain as well. So we can reduce anxiety and depression. You'll get a better night's sleep. So we all know that a good night's sleep makes us sane the next day. If we don't have a good night's sleep, we're often slightly on edge. We, are more nippy at people. And, if we can get a better night's sleep from massage, then that just gives us everything for the next day as well. It helps build our connection with our family and our friends because we are more alert, we're more open, we're happier. So massage in itself, as you say, not just physical, that whole mental aspect, but also the connection back to the body. If you have had surgery, if you've had reconstruction, if you've had amputation, if you've had different types of things that affect your appearance, then massage can actually help that reconnect from the mind back to the body to feel more whole, to feel more you, and have that part of the body that might not feel connected actually feel more connected with you, which mentally puts you in a far better state as well.
Oh, absolutely. Thank you so much for kicking it off in the world of massage. I always just go, oh, that automatically makes me feel relaxed just thinking about it. I'd love to jump over now to Dr. Juanita, who is all about acupuncture as well as all of Chinese medicine. So acupuncture is one of those areas that, most people sort of haven't tried. They then suddenly hear of someone who's got a bit of acupuncture and they've raved about it. Why do people hesitant about acupuncture, and what types of health conditions could you use acupuncture for?
Absolutely. Look, I think acupuncture shouldn't hurt. So a lot of people come into the clinic and they're quite scared of getting acupuncture. But if you're qualified, it's not very painful at all. It's quite a relaxing treatment. Because we're APRA registered, I can't go and talk about conditions.
Yep.
But one of the main things that I do look at is a lot of fertility support and any type of mental health and well-being and pain syndromes. So when people get acupuncture treatment, sometimes they're seeing they've got a healthcare plan from their doctor and they use me as to complement that. So where the patients are going through IVF support and they get a lot of anxiety and stress, acupuncture can really help them feel more relaxed. Yeah. So actually, a lot of people, they're surprised after their acupuncture treatment at how relaxing it is, and it's not painful at all.
I totally agree. I must admit, because you think of acupuncture and you think needles, they are tiny needles. And I've gone and had acupuncture. One of my daughters had it first before me because she had Bell's palsy that wasn't fixing naturally, and it's pretty distressing. And she had acupuncture, and I watched her have it, and it was very successful. So I can say what successful is. But I then had some acupuncture, for that same bit for relaxation or just to shift energy around my body, things like that. And I was really surprised by two things. One, it didn't hurt, and two, I did feel very relaxed after it.
Absolutely.
Which is amazing.
The sense of well-being that you get from acupuncture, it's like it's like you've had a holiday. You've come out, you feel more relaxed. If you've got stress in your life, you're better to be able to respond to that stress. You sleep better and your mood's improved. So, and pain, it's very, very good for pain relief as well. It's pretty amazing when you walk out and you feel relaxed and you're like, oh, I feel like I've just been on a holiday. Feeling a bit of a holiday.
What is the difference between traditional Chinese medicine and Western medicine, as in their approaches? Can you just sort of share for those people who like, well, what is traditional Chinese medicine?
Yeah, absolutely. Traditional Chinese medicine, or TCM, is actually based on a totally different paradigm than Western medicine. So it's based on Eastern philosophy. And it's based on the theory that we have a vital energy flowing through our body known as qi. So when there's a blockage in this qi or not enough qi, it can lead to disease. So I often talk to my patients about imagining that we've got an electrical circuit running through our body, and if there's a blockage, it doesn't work, and that's when things aren't flowing and disease is created. Another thing with Chinese medicine as well is that it's not a one size fits all. So they've got a saying in Chinese medicine is same disease equals different treatment. So what that means is that if someone was to come in with a headache, like two people to come in with a headache, they'll be treated really differently because we look at the individualized approach, and so we tailor a treatment plan for them. So it's not a one size fits all, which it is in Western medicine, but in Chinese medicine, it's a very individual treatment.
Wow.
Yeah.
I love that. I love that everyone should be treated uniquely, you know,
Yeah.
from a one perspective, but from that sort of personal perspective. I love that. So is there a problem though for people who go, oh, you don't have to be all in though, do you? You can use a bit of both, you know, you can if people go, oh, I only do this now.
No, absolutely. In fact, I prefer that my patients have got their GP, their specialist. I think that working together is one of our strengths in Chinese medicine. So to really complement Western medicine. So, you know, it's really important to have a diagnosis from Western medicine and a treatment plan, and acupuncture can really support that process. So we can manage the symptoms and we can really support the person on their journey to health, both a best of both worlds approach.
And so why did you specialize or get right into fertility treatment through acupuncture?
Well, yeah, I kind of just fell into it really. I just had a lot of patients that were having trouble. I'm really passionate about IVF support. That's one of my things that I really love because I think it's very stressful for both partners. And it's nice to be able to really support them working with their specialist and do acupuncture around their IVF cycle. So I really find that beneficial for them.
Oh, so important, so important. We're going to jump over to Anthea now, who we're going to look at, naturopath. You know, what is a naturopath? What is herbal medicine? Nutrition, obviously, we know nutrition is so important, but it seems to be challenging for many of us. So why do people suddenly go, I would now go and try seeing a naturopath, first of all? And what would happen when you go and see a naturopath?
You for asking. I see naturopathy, and perhaps I see it more like this now, being as a practitioner of nearly 30 years now, that we see persistent chronic symptoms, and people are kind of a bit maybe tired of the treadmill of managing diseases and symptoms, managing their diagnosis, and they want to address the underlying causes and contributing factors. And so as naturopathy, this big umbrella, which has many modalities such as herbal medicine or nutrition and so on underneath it, we're looking at an individual very holistically, mind, body, spirit, soul. It really is up to the practitioner, the naturopath, to be well versed in that, to have studied and in all of those modalities, I think, under the umbrella of naturopathy. So that when we see a patient with persistent, chronic, ongoing symptoms who have been managed for a long time and who want to get to the roots of, like, I'm sick and tired of feeling sick and tired.
Yeah.
That we sit with them and we journey through an initial consultation of really getting to know them, what makes the symptom tick. How do they feel every day? It's putting the patient back into the environment. So it's looking at that interdependence and interconnectedness of the individual with their environment, what they're eating, their self-care habits, their self-care practices, their stress levels, their work levels, and so on and so on. So it's what we call, I think of it as a very holistic, integrative approach to addressing any symptom or any persistent disease state.
Mm. So an example, I'll just make myself the example today. I was having a little hot flush down at a conference the other day, and one of the ladies there said, I'll just get everyone else to mute themselves if that's possible. Um, someone was saying, you need some herbs, or you need to, and I'm like going, how would I know what herbs to get? How would I actually approach that? Sorry, whoever's not on mute, can you unmute yourself, please? I'm not too sure who that is. There you go. So yes, how would you, when I go to a naturopath, would you then determine, is it Annie's, is it my hormones? Is it my diet? Because you're into nutrition. Is it that I need herbs? Is it a different treatment, like we were saying before, for different people? How would that approach go if I was a first timer going to a naturopath?
Yeah, I think it's meeting the individual, the patient where they're at. So if they're completely new to this, I mean, it's assessing what they've already done, what they've already been doing, how they're already looking after themselves. It's making them aware that it's not one thing is a swap out for another thing. We all have different starting points. We all have different unique expressions of a particular symptom. We have different reasons why symptoms come about. So sometimes we need first aid. And what I mean by first aid, some people don't have any capacity. Everything's stacked up against them to heal. So sometimes they just need that immediate relief, whether it's creating more energy or better cognitive function or whatever the pain relief might be. So may prescribe herbal medicine, but we may prescribe some nutritional recommendations, or it might be that we prescribe, we refer on, I think you need some massage or some acute acupuncture. We can make certain changes, get you kind of stabilized or regulated, if you like, before we do the deeper work.
Mm.
We're not going to let someone be bleeding on the sideline and think, oh, we've got to address the underlying causes. It's like, no, let's like really maybe first aid, alleviate, create some capacity, and then look at what is required. And sometimes we need to do further testing. We're gathering information. We work with the patient's doctor or specialist, and sometimes that initial phase is just gathering information whilst providing some first aid alleviation. And then once we have a better understanding, then we can implement some steps, treatment, self-care habits. But again, always looking at it very holistically. So I think with hot flushes, that can run deep, but that could also be fairly simple. If the underlying cause is hormonal, then maybe not so simple, not so hard either, but if it's due to metabolism or an overactive thyroid, again, it just depends on the underlying causes and contributing factors. That's what will determine treatment.
Fantastic. I've got a question from one of our visitors today. How do you balance food as medicine? You're into good quality food is your medicine, but then we also sometimes need to use supplements.
Mm.
How do we juggle that?
That is a great question, and it's one that I always hold every single day when I see my patient. I think, when I wrote my book, How to Eating Your Way to Health, it's called I Am Food, Eating Your Way to Health. And I wrote it probably in a very high church kind of way many years ago, in that everything can be cured if people ate really well. And we know it's more than that because people are stressed out. I think we're finding that our patients don't have time to heal and don't have time to self-care, and everything is stacked up against them. And they kind of don't even realize they're stressed. They're like the boiling frog. They don't even realize they're stressed. I have to convince my patients that this is what stress is. So again, that part of that first aid alleviation, perhaps they need some supplements like a protein supplement because they're just not eating protein. They don't want to eat protein. They can't digest protein. So we give them a protein supplement because this is how you could feel. Would I prefer that they did whole foods, well sourced and processing, supported their digestive system so they can eat well? 100%. but it's not how we meet patients. I meet stressed out, overworked, overwhelmed, low energy patients managing diseases. That's what we see. So with that comes people are not eating enough, or they're eating too much. They've already got nutritional deficiencies. They don't know how to prepare their food well. They skip a lot of food prepping techniques which support optimal digestion. They're not buying the highest quality food. We, recommend organic farming or whole food. They're also present with really chronic digestive issues which impact the way they're digesting and absorbing nutrients. They present with dysbiosis, an imbalance in microbial organisms in their gut, or they might be hosting a parasite. They present with chronic diarrhea, which just basically washes all the nutrients out. They may have genetic predispositions that require more nutrients, and even just stress increases the requirements of more nutrients. So coming back to that question, supplement or food, can I say both?
Yeah.
And ideally food, but sometimes we do need to supplement.
Yeah, fantastic. And before we go to the panel, and definitely pop your questions in. Hello from Perth, Ebola. That's great. We're coming to Perth for our Business Success Weekend very soon, so I look forward to seeing you there. Definitely pop any questions you've got for our guests today. I would love to ask them, but I will just finish with one before we go to a bit of a panel chat, which is our food good enough as it is? Some people got to go, oh, it depends where your soil quality, it depends what it is, or you have to go organic. So if you're just the average Australian, just eating food, you go to Woolies or Coles, you try and get things as fresh as you can. Is that food enough in its quality from your perspective, or would you still potentially have deficits, whether it's, I don't know, magnesium or something, because you can't get all your health from foods just from supermarket type foods?
I think it depends on the individual. So we say start with fresh whole foods, minimal processing, well prepared, eating in a relaxed state, chew your food until liquid. So you are what you eat, but you're also how your digestive system responds to that food. Are you eating in a stressed out state? As Amy mentioned, we best digest in a rest and digest, which is the counterbalance to fight, flight, and freeze response. So I don't think it's so simple. The ideal is, and not just for human health, this is for everyone's health, to eat organic, to eat biodynamic, to eat minimally processed food is good for everyone, not just the individual. It means less toxic chemical exposure. It means nutritional soil, better for soil farming, flora, fauna, plants, animals, the whole kit and caboodle. That's what's ideal. Not everyone can afford it. Not everyone can access it. If you can buy organic and you go nose to tail, you don't have any food wastage, it can be done. And I see patients from different economic backgrounds. It can be done. It requires effort, but people don't have capacity when they're coming in sick and tired and overwhelmed and stressed out. But I say start fresh. Perhaps you might get all the magnesium from your diet. Perhaps you won't, because you might have increased requirements. But at least start off with fresh and seasonal, local, tick those, and we see what unfolds from that.
Fantastic. Thank you so much. I'd love to open up to any of our panelists to say, well, what do you wish more Australians knew about natural therapies? There's so many different types of natural therapies. Even our organisation, we've got 20 different modalities. What do you wish they just thought about or knew about natural therapies?
It's a tricky one, isn't it? I think maybe what I think is that I just wish it was available for the elderly. Acupuncture is just so amazing for pain relief, and I've got quite a few elderly patients that they've actually they're on a care plan, so their hospital care plan does actually cover acupuncture. And I had she was 89 and she broke her back and very, very painful sciatica. And obviously we don't needle the local area, but we do distal acupuncture just because she can't sit or anything or lie. And the pain relief and the quality of life that she's receiving is just second to none. So I really wish that it was available more for that. You know, like I've got quite a few. Another elderly patient, my eldest patient's 93, and she came in with chronic fatigue quite a while ago, and we just got her feeling better. She's got so much energy. She's able to go for a daily walk and get her coffee and do her day-to-day activities. So, and that's when, unfortunately, Western medicine for her, there was nothing wrong with her. All her blood results were in the normal range. And we were able to help her with acupuncture and also a little bit of naturopathy as well. And she's actually having a great quality of life. So that's what I wish that was more available.
Yeah, that is so rewarding.
Yeah, it's rewarding.
What about you, Amy?
For me, I really wish that people realised that we are complementary to Western medicine. You don't use us necessarily instead of. Use us in conjunction with, and even in conjunction with each other, you know, massage with acupuncture, massage with naturopathy, naturopathy with acupuncture, and with your medical practitioners, with your exercise physiologist, physio, chiro, all that kind of stuff. They actually complement each other, and you can often get far better results when you do use them in conjunction with, rather than seeking someone out and just going all into that one thing and not doing anything else. But also that we aren't a miracle cure either. That, you know, we need a couple of treatments at least to actually work through some of these things, because a lot of people come to us after years of having some issues, and they hope to get that one-off treatment that's going to cure them, and it's not the case. If you've had things for years, it's going to take us a while to probably work through the years of build-up of compensatory patterns, of other issues that have ricocheted because of that one thing. And that could be even, you know, that you've been on medication that's caused some side effects, and we're trying to work with those side effects. You know, if you're still on the medication, it's still causing the side effects, then we might be able to help. But because you're still on the medication, chances are those side effects will come back. So you'll need to have continual help from us. So yes, it's not a miracle treatment, but it is also very beneficial used in conjunction with everything else, not just as a standalone.
Fantastic. Thank you. And Anthea?
I want to be really bold here, because I think I can be, as a practitioner who's been around for 30 years, is that natural therapies and natural medicine and the way we approach it very holistically is how I want conventional medicine to be moving forward. I as a practitioner am really sick and tired of seeing my patients suffering immensely and having their symptoms and diseases reduced and broken into fragments, reduced into symptoms that either is a sign or a lab result or a number, just another patient. And I suppose that, you know, choosing this approach completely opens up your entire life and existence and world. And I say that as a clinician in real life experiences, that each symptom or feeling that you have has a thread to it that's connected to everything else that exists. And you meet and tend each one, and really look at the reasons and the whys, and what is it trying to tell us that we need to meet and tend to. And it can be so incredibly deeply healing on so many other levels. Even if it's a symptom that might be just persistent eczema, might be connected to something very deeply emotional, mental, psychological, spiritual, something else. And I find that's the most rewarding piece, is that you take patients on this journey of very deep healing, and it's not only their symptoms that get met or alleviated, it's so much more than that. And then they pass that on. It's this way of being that they then pass on to their family members and other relations and friends. And it's it's beyond just self-care. It's caring for the greater community at large when we do that, because every choice we make affects everyone. So when you choose to holistically self-care and heal, there's a ripple effect that it impacts so many more. So that's what I want everyone to know, how incredible it is. And really it's where I want conventional medicine to transition into.
Yeah, I think it's exciting. I think it's getting there with that. I mean, in the University of Western Sydney, they've actually got their Chinese medicine research centre, and they're currently collaborating with Liverpool Hospital in oncology research. So I feel like that we're getting there with that. And when I was in China, they did have, like, you had the hospital and you had the acupuncture department, you had the gynecology department that did do Chinese herbs, that did do conventional medicine. It was all an acupuncture. So I feel like that we're getting there. It's taking a while in Australia, but it is happening, especially with the research centre in University of Western Sydney. It's really exciting.
It is super exciting.
Yeah.
What I love hearing is how complementary you are to traditional medicine, but also to each other. And so
Yeah.
that I love what you said there. It's like we don't just go, I just see this one naturopath or one acupuncturist. It's a bit like, well, there's going to be someone who may be more relevant at a specific time because there's a lot of natural therapies. And so I'm assuming you therefore refer to each other. And one of the most ideals I would love to hear about is how do people, because I've been asked this a number of times, how do you find a integrative GP, someone that when you go onto their doctors, they actually know who to send you to from a natural therapy perspective? Or are they so rare and we just have to hope we'll get more? Because that's a bit of a missing link in our community.
Yeah, I reckon I've got quite a few GPs that are pretty open to what we do
Good.
in this area. Yeah, yeah, I kind of see them as my colleagues. So yeah,
Excellent.
they're pretty happy with working. They do their medical tests and they're quite happy for their patients to come for acupuncture, especially with IVF support. Now the specialists are actually recommending that they go and get acupuncture. They're very open. A lot of them have got acupuncturists, naturopaths working with them. So I feel like that it's getting better and better.
Yeah. More
I do think it shifts kind of within each industry as well. But I think with the medical practitioners, they're not really taught about natural therapies. So as practitioners, it really does sit with us to approach those people and let them know that we exist in their local communities and how we may be able to benefit their patients, when would be a good time to refer on to us, and open those pathways up, and also know how to appropriately refer back to the medical practitioner when it's necessary as well. And a couple of years ago, I was part of a team who organised some research into letter writing. How do we write a referral letter back to a GP? And there wasn't much out there in our industry, where we aren't necessarily taught in our base training how to do that. So it is something that I think over time as well, with education, will change in both industries, that medical centre and then the natural therapies. It is shifting. Like Juanita said, fertility care certainly is up there. Oncology is getting there as well. We have lots of integrative oncology centres which have natural therapies on board. But certainly, if we as the practitioner introduce ourselves to the local medical practitioners and other allied healthcare services, they are very open to referring on to us. And that's what I found locally.
Yeah, I love hearing that. And also because times like Natural Medicine Week, it allows, last year we had over 4 million people interact with Natural Medicine Week. So you've got a very big changing consumer base from Australia who's actually more likely to actually say when they're at a doctor's, it's like, well, maybe before I take this medication or before I do this specific treatment, I might, can you refer me to someone, or I'll try that anyway. Sorry, I think I cut you off, Anthea.
Oh, I was going to say, I think in my experience, because I've got a background in working in medical centres up until 15 years ago. So I was always working in an integrative practice. I work with incredible GPs and specialists that refer lots of patients. That's how we see our patients there. It's either patient referral, practitioner referral. I think, though, it is very different speaking to patients, that most of my patients do not have good experiences and wish it was very different for them, because our patients are often, and I encourage them not to, often hiding that they're seeing another practitioner or an allied practitioner or a complementary practitioner. And it's like, don't hide us. We want to work with your doctor. So they say, but can you refer me to another doctor you work with? And I usually push back and I say, no, I'm going to work with your doctor. That's your family doctor. So we write them a letter and make them aware that their patient has come to see us for the following reasons, and we would like to work with them. And I think that that's pretty effective and that works super well. But most of my patients' experience is that they've kind of just fallen through the gaps. And we end up being the case taker of pulling everyone together, whether it's via phone calls or referral letters or getting to know you letters on behalf of the patient. I think there are very few integrative GPs that are taking on clients now. I think their books are becoming very closed. I've known a lot of them over the years, and their books are closed solid. And I think, Amy, you're right in that this is not their forte. It's not what they study. And I think it's very different seeing a practitioner who has studied nutrition, has studied herbal medicine, because we're not just saying take oregano oil because you've got a parasite, because oregano oil may not be indicated for you. There is just so much more to our prescriptions and to our recommendations. And that's what we study, and that's our clinical experience. So I often like just working with a general GP, not an integrated GP, for that reason.
Absolutely.
Yeah.
Absolutely. 100% agree.
Good on you. I love hearing all of this.
I'm so sorry, Annie. I'm going to have to run because I've got
that's okay. No
so
problem.
sorry.
Thank you so much for joining us. We greatly appreciate it. So have a great day. And we will continue for the rest of us. Definitely pop a question in the chat. Anyone, don't be shy. Otherwise, I'll ask all the questions, which is fine. We're having a fantastic conversation, but I always like to ask yours more. I would love for you both to share then a little bit about your training, because often people go, oh, are they qualified? Do they, is it very significant? And I'm like, yes, they're extremely well qualified. So I would love you just to share a little bit about the breadth and the depth of what it actually means to become a massage therapist or become a naturopath, herbalist, or whatever. What does that actually look like? Just to give confidence to the consumer to go, yeah, absolutely. They have gone to a proper college and had proper training, and have a lot of expertise in their area of specialty, because often many of you go into an area of specialty.
All right. Anthea, would you like to start first?
All right, lovely. For me, I studied so long ago. It was we at ACNT, and we received diplomas of botanical medicine, homeopathy, and naturopathy. And then I did a degree in health science after that. But now naturopaths can do naturopathic degrees, which is so fantastic. But as ongoing education, and as part of ATMS, that we need to keep doing our own educational in our own time. And the reason being is so we can keep up to date with the most current research and new ways and techniques of using natural therapies. And so we're constantly, and I'm sure Amy's the same, we're constantly reading, studying, involved in everything, turning up to every webinar or conference, because we love it so much. It's what we do. We live and breathe it. So it's very exciting for us. But yes, we're always trying to be on the pulse of all of this.
Yeah. I love that. I love that. Yeah. So yeah, definitely have been to Australian colleges, universities, had high level qualifications, and then that's exactly it. All of the practitioners that you're hearing from as consumers belong to ATMS, and we're the peak body looking after natural medicines for Australia. We have, thousands of practitioners from different modalities, but all of them have to then show every year, do you have your first aid certificate? Do you have insurance? Have you done a certain amount of points? We ask for 20 points aligned to their specialty. And that means that they've gone off for those extra training sessions, webinars, they've had learning opportunities that really make sure that they can confidently present back to their clients and the greater public that they are current in their qualification, much like a doctor or nurse would do. We marry that sort of or mimic that same sort of requirement. Amy.
So for remedial massage, like Anthea, I trained many, many years ago, and I actually trained before the government took over the health training packages for massage. So what is current day? The Diploma of Remedial Massage is a nationally accredited course under the government, HLT qualifications. So every couple of years they get updated, but essentially if you have trained in that, generally takes about 12 months to do your base level training in a Diploma of Remedial Massage. That will get a practitioner their health fund provider status, so you'll be able to claim rebates as long as they're a member of a professional association like ATMS and they hold their insurance. That is going to be the first level of training. Then on top of that, I kind of say Diploma of Remedial Massage is great. It trains people to work with generally fit and healthy people really well. Then it teaches you to adapt for medical conditions, for sports, for things, pregnancy, all that kind of stuff, but doesn't really go in depth into any one of those things. So if you have intense medical conditions, especially if you have something like cancer, you should be seeking out an oncology trained massage therapist, and that is somebody who has done then postgraduate education in that. There is pregnancy massage training as well. People will go off and do more advanced courses in sports massage. So all those additional things on top of our base level training really head us off in our niches. Manual lymphatic drainage, if you've got lymphedema, you want someone who is trained to work in lymphedema, not just generic lymphatic issues. So yes, that postgraduate education is really important. But that base level, essentially I say, check if you can claim via your health funds, because that gives that base level. That's the way to check a practitioner is, I suppose, qualified to the diploma level. That is that base in Australia for the healthcare side of things.
I think that's excellent advice to everyone here today. That's like any normal medicine that we know. People, get trained and then they specialize, and all of the natural therapists can then find those niche areas that they then specialize in. One's just a passion point, might be something that they've personally experienced, could be a whole lot of factors, but there's definitely, just for you to know, yes, you can have someone who can do that qual, but you can also ask if you've got something specifically. I'd love you to finish up, we've only got 10 more minutes left, of just sharing an example of a case study. You don't have to give too much information. Case study of someone who came to you after they weren't so happy with traditional medicines, and what was the outcomes? Why are they a happy person today, a happier, healthier person today, because of the treatment plan that you personally had, or you may have had that collectively if you were integrating with other therapists as well?
I think for me, someone who, obviously I specialise in oncology massage. I also have two other specialties, so scar massage and lymphedema treatment. They combine really nicely for the cancer patient, and I do find that in cancer care, it is very fast-paced. The treatment is very intense, and there is this kind of expectation that once you're out of treatment, you're just going to go back to normal, and it's not the case. There is a new normal, and each person will be different with that. But there are lots of lingering side effects of treatment, and things like surgery. If you've got a scar or if you've had radiated tissue, that can pull through separate, like certain areas of the body and cause range of motion issues. It can create tightness, it can be painful, it can be hypersensitive, itchy, tingling. And it's a daily reminder of what you have been through.
Yes.
You're alive, you're grateful to be alive, but you can mention those things to your doctors left, right, and centre, and they don't know what to do with it because they're there to treat the cancer, and they're not then educated on those lifelong side effects of scar tissue or radiated tissue and things like that. Mm. So for me, having patient come in post-treatment, usually they find me either via referral, or it could just be that 2 years post-treatment, they're a bit fed up with life because it should be better than this. And they come in, and through gentle, non-inflammatory massage, we can get that soft tissue feeling nice and supple again. We can get that range of motion back. We can have that sensation in that radiated tissue or scar tissue feel more like normal tissue. So it feels more like their own self again. And that connection emotionally and mentally back to the body is really important. It feels like they can achieve daily living activities again. So it might be for breast cancer patient, they might not be able to reach up to get a mug off the shelf, something as simple as that. Or they might not be able to put their hands up to wash their hair or blow dry their hair. Or they might not be able to put a bra on. Someone who's had bowel surgery might not be able to bend over to tie up their shoelace. And often it is just that tight, dehydrated tissue that needs to be more supple and needs to get that slide and glide function back. And so that's where often I think that traditional Western kind of medicine misses that aspect of care because they're working on the life-saving aspect. Yeah. And then afterwards, they've got the next patient coming in who needs life-saving. So, yeah, we can come in with more that rehabilitative type of treatment and just help enhance quality of life again, whatever length of time that life is.
Yeah. Oh, I love that. And that is super rewarding. I know sometimes it's just the basics that actually do change people's lives, you know? So that's something like that. I remember my mother-in-law stopped going to a shopping center because she had to pull her arm out and she couldn't get the little ticket anymore. And I thought, what a sad thing. And that's a range of motion sort of experience. And so, you know, they're little things that it's not just that. That's, as you said, putting your bra on, tying your shoelaces, doing things that affects people's lives greatly. So yes, the power of a remedial therapist in that way is absolutely amazing. So let's just finish up with any of our members here. Anyone wanting to ask a question? You're all very, very quiet here today, but if you've got a question to ask any of our panel, I would love you to write that in the chat. While we're waiting for that, I might get you to share then, what's one patient that you've had that is an unlikely patient that came to you but still you benefited from your therapy? Is that a possibility?
Yeah.
Yes?
Many of those.
Like I get very unusual. Yeah. What's something a little bit unusual?
I was just going to say, Amy, thank you so much for sharing. I'm going to refer many of patients with cancer to you because I've only just met you, Amy, and your work sounds incredible, right up my alley. Thank you.
Thank you.
So we sometimes will get patients that have chronic persistent digestive symptoms, as is very common, who probably would never have considered natural therapies because they've been managing their symptoms, whether it be constipation or diarrhea, with medication. And sometimes, again, they're sick and tired of feeling sick and tired. So they decide to seek expert advice and want to explore but the why. So we do, a comprehensive stool analysis test, which is to see the state of their gut microbiome. Can they digest and absorb their protein, carbs, and fats? Have they got good first line of defense? Are they hosting any pathogens? Do they have enough beneficial bacteria? And in some of these cases, it's so surprising. It's as if their gut's been sanitized. Like, you think, what has happened here? There's this complete annihilation of beneficial bacteria. And then I think, antibiotics, being on the pill, lots of pain medication, lots of preservatives, swimming in chlorinated pools, things that act like antibiotics. And just, through natural therapies and food as medicine and supplement support, we can do a good gut garden and reestablish a healthy gut microbiome. And often it's like not the thing that they would consider, because it's just, I've got constipation, take a laxative, or I've got diarrhea, take something that'll stop the flow of stools so frequently or urgently. So I think, sometimes it's approaching it in a way that they wouldn't have expected. Yes, food is medicine, but it's like, oh, hold on, let's look at your gut microbiome that influences motility. And then that sometimes we think, oh, what about their nervous system via the gut-brain axis if they're in a constant state of fight-flight? So then we're focusing on their stress levels, and sometimes they don't think that we're going to do that, but then that becomes the focus.
Wow.
Mm-hmm.
Amazing. Amazing. I think it'd be so fascinating to be in your chair and just seeing who comes in the door next. And it could be anyone. It could be any of you coming and tuning in today. So I would just like to thank very much all of you for coming along and for being part of this webinar. It's great to have you here in Natural Medicine Month, really. We've got free webinars every day of the week for the next month. So just definitely jump onto naturalmedicineweek.com.au. Jump in for them. Apologies for today's challenging start. We did have tech issues on the platform we were using, but that's okay. We've reshifted and we're going to stay on Zoom moving forward because it's actually very easy. Sometimes you get a bit too fancy for yourselves, don't you? I would love to do a big thank you very much to Anthea and to Amy. And it's just been absolutely fantastic having you come and share your knowledge with us today. Yes, we will be leaving their details. They can pop that in the chat if you like now, and they will also be leaving their details when we post this back out to everyone who has registered. We'll also be popping this on our YouTube channel so that you can come back and actually watch it again if there's something that you've missed. If you came in late, a few people came in, that's okay. It will be there ongoing. So enjoy today. Keep yourself really, really healthy and well. Start thinking of little ways that you could just do a little bit of an assess and think, is there something you might need a natural therapy practitioner for? Contact ATMS if you do need someone via atms.com.au. And we're really just happy to hopefully have added some educational value to you all today. So thank you so much for joining us. Thank you, Amy. Thank you, Anthea. And
Thank you.
Thank you to all of you. See you again very soon. Bye-bye.
Thanks, Annie.
Thank you, Annie.